And risk factors of maxillary sinusitis of endodontic origin evaluated by dynamic navigation and a new filter cone beam computed topography by Cyntia and Estrela2022. The presence of maxillary sinus infection associated with apical periodontitis has demanded an interdisciplinary approach from healthcare. The American Association of Endodontists recognized that correct diagnosis of maxillary sinusitis of endodontic origin should be made to achieve therapeutic success, and the frequency of misdiagnosed negatively affect the persistence of sinus disease. The aim of this study was to determine the frequency and risk factors of maxillary sinusitis of endodontic origin in posterior maxillary teeth, evaluated using dynamic navigation and novel filter cone beam computed topography imaging. The inclusion criteria: CBCT scans were selected for the study if they include erupted first, second premolars and molars with complete root formation. CBCT scans showing presence or absence of endodontic treatment, apical periodontitis, periapical osteoperiosteosis, reactional osteogenesis, periapical mucositis, partial or total obstruction. And the exclusion criteria were cases with orthodontic treatment, internal or external root resorption, developmental disorder, bone changes associated with systemic disease, and benign or malignant tumors in the maxilla or maxillary sinuses. And only high-resolution CBCT volume have been included to ensure analytic accuracy. CBCT scans for 453 patients, 814 teeth were selected. Data were divided into 4 groups. First, root canal treatments. Second, relation of the root apices to the maxillary sinus. Third, apical periodontitis. Fourth, maxillary sinus inflammation, including no inflammation, periapical osteoperiosteosis, periapical mucositis, partial or total obstruction. For the result, they found that maxillary sinusitis of endodontic origin was found in 65% of the cases. 54% of them had root canal treatment, and 62% of them had periapical lesion. The evaluation for relationship of root tip to the sinus floor revealed that 53% root tips touches the sinus floor, and only 12% of the root tips overlaps the sinus floor. And the most frequent abnormalities were periapical mucositis by 44%. The second was partial obstruction by 15%, and the least frequent was total obstruction by 0.6%. Maxillary sinusitis of endodontic origin is well-studied pathological condition that should receive professional attention during diagnosis and root canal treatment, and the frequency of maxillary sinusitis of endodontic origin is higher and has positive association with root canal treatment and apical periodontitis, and the root apices position in contact with the floor of maxillary sinus.